All right, well, welcome everyone. My name is Alex Lieber. I'm one of the co-authors of the Tobacco Atlas, sixth, the American Cancer Society, for about 8 years. And during that whole time, I've helped make three tobacco atlases. So I very much love this product, and I'm excited to share uh, what we do with it with all of you. Um, First published in 2001, the Tobacco Atlas has always sought to be the world's premier reference for all things tobacco control. The American Cancer Society and Vital Strategies partnered to release the sixth edition of the Tobacco Atlas in March of 2018. These days, most reference materials, from the dictionary to the encyclopedia, have moved from paper to the internet in order to be accessible, updatable, and current. The Tobacco Atlas has done the same thing. In its most recent iteration, the Tobacco Atlas website is more functional, better designed, and content rich than it has ever been before. Information and tips about all the functions, features, uh, we have essentially four basic sections. First, we have the Issues tab. This section of the website broadly covers the major issues of concern to the tobacco control community. You can think of them as problems or as concerns too, but these are the areas of focus if you are looking to learn about the massive trouble caused by tobacco use and or the tobacco industry. Much of the content from these pages is included in the print edition of the sixth edition of the Tobacco Atlas, but some of the pages are web exclusive content. Next, we have the solutions section. This section of the website broadly concerns how we tackle the major concerns and challenges of the issue sections of the website. Most of the emphasis is on policy solutions and includes discussion of the scientific basis of these policies, as well as approaches for advocating successfully for these policies. It includes the best information on evidence-based methods to counter the tobacco industry and provides examples of success and less successful campaigns for policy change. Third, we have the countries or fact sheet section. If you click here, you're taken to country fact sheets. These, as a subject, we'll be covering in greater detail later in the talk. But essentially here, you can find your particular country and download a country-specific fact sheet with specific information that we'll cover more in detail later. Then there's the news section. This is the home of what we call our Tobacco Atlas blog. Here, we frequently feature new articles containing news about developments in tobacco control policy, research, and advocacy initiatives. Special attention is often paid to the efforts of the Prevent 20 Coalition, which is a coalition of cancer organizations around the world promoting tobacco taxation as an effective cancer prevention policy tool. We can talk more about Prevent 20 later, but we're very proud to be a very close partner of that initiative. Finally, we have the languages section. Currently, the Tobacco Atlas website is available in English, is also available in Spanish, and certain articles are totally translated. Other ones are awaiting such functionality. But all of the basic sections of the solutions and problems, or problemas and soluciones, are available in both English and Spanish. Functionality, the pages being printed in Portuguese, Chinese, Arabic, and French are all coming soon, and we can't wait to be able to feature those that content. Next, we wanted to point out that our entire website is totally searchable. So if you have a particular question, say about illicit trade, you can search the word illicit and it will bring up not only the topic section for illicit trade, it'll bring up any news articles that we've had, and even down to data visualizations and individual components of the website that would be available on the subject. So But let's talk about why do we have an atlas in the first place? Uh, we know that the Tobacco Atlas displays many kinds of data. For some concepts, the best way the authors decided to explain the differences was across geography. Therefore, we employed two basic kinds of maps because, as you know, atlases correspond to maps. That's what we do. So the first kind of map is a map of various points. For example, in the manufacturing chapter, we have a map titled Where Disease Originates, which plots the location of the largest tobacco product factories in the world. In order to use this map, the user can select any point on the map with their mouse cursor or finger, depending on if you're accessing this on a tablet or smartphone or a PC. And to see the location, the name of the factory, and the product the factory makes. The legend for this map is a color code telling us which dots represent which products. Below the map are three important buttons: Sources, Download, and Share. These buttons enable the basic functionalities that users can take advantage of to either learn more about where the data in the map came from, where the data in the map came from, how they can access the map's data themselves, or how to share the content with others. Under the Sources button, all sources which are available on the internet for access are hyperlinked for the user's convenience. So you could click through. Under the Download button, we have the option of downloading an image in the portable network graphic format of the underlying Microsoft Excel file at which the map's data is based, or the Microsoft PowerPoint slide showing the map's content contained, including Tobacco Atlas branding. If you click the Share button, you can share the Tobacco Atlas content on Facebook, Twitter, or LinkedIn. The second kind of map you'll see on the Tobacco Atlas website is a choropleth map. A choropleth map is a fancy way of referring to a map where different colored spaces on the map refer to values or categories that are specified in the map's legend. If we look at the societal harms chapter, we can examine a great example of this kind of map, where here it is entitled The Economic Cost of Smoking Attributable Diseases. The map colors most of the countries around the world in a shade corresponding to the total economic cost of smoking to their country in denominations of 10 purchasing power parity adjusted US dollars. If we were to say hover our mouse over a particular country, for example, Madagascar, we would see that the smoking attributable disease cost that country 127 million US dollars per year. If we click the Sources button, we see that all these data derive from an important article in the journal Tobacco Control. We invite the users to search for the article. And learn more about where the data came from. As our longtime readers well know, the Tobacco Atlas was built on creating just this sort of map to convey global information about the world's tobacco epidemic. We do our best to produce the most useful and comprehensive mapping information possible. If you see that a country is missing data, or you know a good data source to fill in that gap, please send us your new data. We will do our best to update the map with the new data if they're reliable and valid. For example, our map of water pipe tobacco use prevalence is rather bare in certain countries. So if you know of a good particular source of the number of people who use water pipe in Indonesia, we would love to know, and please send us something to help us out. We'll tell us more how to reach us at the end of the presentation. In the previous section, I told you how to download data from the Tobacco Atlas maps. Here I want to point out that there's so much more data available on our website. Under any graph through the entire website, a similar download button is available where you can download the data for that corresponds to that figure. So you could download this information about water pipe use in Syria, and you can sort of see how you could plot that sort of same map on your own computer. For example, we have downloaded here data from the prevalence chapter, just over here, where you could do your own particular analysis. So if we look here at male and female smoking, you could download the data, and then we have it sitting here. We have information on the prevalence of smoking among men and women in different countries. And you could do your own analysis, say looking at what is the ratio between male and female smoking in different countries. And then, if you wanted to, you could create your own figures. So here, we're using the maps function in Excel to create a figure looking at the ratio of female smoking prevalence to male smoking prevalence. And we're totally OK with you using this particular data, so long as proper credit is given. So you could make a graph just like this, drop it into a PowerPoint presentation just like this. And we are all right with you using this data so long as tobaccoatlas.org is giving credit in your presentation of the information. So we totally encourage you to use information that we have posted in your work around in academia or in advocacy. Use our facts. We are totally all right with it. Just throw us some credit and that'll be all right. But to make giving our information even easier, we also include versions of our charts complete with Tobacco Atlas branding that you can download throughout the website. So when you see this particular map, you can download image, data, or PowerPoint slides. The PowerPoint slides themselves are going to look just like this one, containing title, subtitle, the graph, caption, and then branding at the bottom of the slide. You're certainly welcome to pop these in and use them in your particular line of work. We totally appreciate any use and credit that is given for our hard work. So when you are looking for sources for this information, though, you should look to just a couple of different places throughout a page. With any particular graphic, there's always going to be a sources tab. Sometimes we will make it as obvious as possible and as linked as possible for our users. But we have general sections of text throughout the particular chapters as well that have sources which you can refer to at the bottom of our pages, and this references tab for a more complete look at the sources that underlie the atlas. Every single page will have dozens of sources, and we encourage you to use and explore them in your quest. This is how most of the atlas works, except for the blog. The blog relies on hyperlinked text. So I wrote this article about Philip Morris International's very questionable use of a new brand called Mission Winnow in the most recent Formula One season. In this section of the Tobacco Atlas, you can click on particular hyperlinked words to go learn about the stories that we have here. So it's more like your typical news source in that sense. Next, I want to turn our attention to our country fact sheets. We are rather proud of these country fact sheets, and we use them, we collect data from all over the Tobacco Atlas to paint a picture of the individualized tobacco epidemic and policy environment in a country. We update these fact sheets as new data is released by major sources such as the World Health Organization. So we should actually be expecting a major update of that data this summer. There are two basic ways to navigate a country's fact sheet. First, on the Tobacco Atlas homepage, you can scroll down to just below the red and blue solutions section. To find a section that tells you how many people die from tobacco every year and how many millions of dollars in tobacco-related costs are incurred in your own country. And view these two statistics. You can select the button titled View, and which in my case is the United States. But in your case is any other country that you would like to be directly taken to. Alternatively, you can select the Countries tab at the top of the homepage to be taken to a search bar where you can type in the country you want to look up. To learn more about the fact sheets, we're going to look at Thailand as an example. At the top of the page, on the right-hand side, you're immediately presented with the option to download a PDF version of the fact sheet. It's rather neat. These all auto-populate, and they're available for every single country and make a beautiful printout that you can give to any policymaker or educator or advocate. Many of our colleagues in the governments and NGOs like to send these to their colleagues to print them and take them to events and meetings. If we stay on the web-based version of the fact sheet, moving on the page, we can see a call to action asking people who work and live in Thailand to help move the ball forward in the fight against tobacco use and tobacco-caused disease. Scrolling down the page, the next section in order is issues. Here, we describe the scale of the harm that tobacco causes in Thailand in terms of the number of people killed, the number of who use tobacco, including children, and a smaller call to action on how to address these issues. After that, you see a graphic showing the number of smoking-caused deaths among men, and the number of deaths if you press the right button labeled women or labeled female among women. If in the fact sheet we work hard to contextualize these horrific numbers by comparing countries to their peers in their Human Development Index groups. Tobacco in Thailand is in the high Human Development Index group. The other three groups are low, medium, and very high Human Development Index countries. Thailand has more men who smoke cigarettes than an average high Human Development Index country, but it has fewer women who smoke cigarettes than an average high Human Development Index country. We make the point in countries who have below group average smoking rates that even though they are doing well, they are, in this metric, they still have an unacceptably high toll from tobacco use, which we would make the case is any toll from tobacco use. In the case of Thailand, we point out that still over 1 million women and nearly 10,000 girls smoke cigarettes each day. Going further into the fact sheet, we will note the prevalence of smokeless tobacco use in Thailand. It is above the high Human Development Index country average. Further down the page, we note that the economic cost of tobacco use in the currency of that country. So here you would see it is in Thai baht. Next on the page, we have a series of 4 pictures denoting the harm that tobacco does to development, the environment, equality, and to other non-communicable diseases. If you select or hover over any of these boxes, a message pops up, a message written below them pops up. For example, under development, you would get a message explaining how much GDP per capita a person would need to spend to purchase 10 cigarettes each day for a whole year. This is commonly referred to as a measure called affordability, because it helps understand how affordable it is to use tobacco products in terms of income and price. In the box titled Harms to the Environment, you are presented with a fact detailing how much cigarette butt and packed waste is created by cigarettes being smoked in a country in a particular year. We also provide the equivalent weight in African elephants to give you some enormous context of the enormity of that statistic. Similarly, useful facts also pop up when you select the boxes for equality and NCDs. In the next section titled Industry, we detail the size of the tobacco industry by revenue compared to Thailand's gross national income in order to demonstrate through relative strength of the Thai government in, say, a court battle with a tobacco company. The 6 largest tobacco companies actually have roughly a similar revenue in total to the gross national income of Thailand. So it may be a fair fight in court that is rather nerve-wracking from the perspective of a government regulating an industry. So below that are figures about how much tobacco is growing in the country and how many cigarettes were produced there. The next major section of the fact sheet is the solutions section, much like mirror of the book. This portion details the policy environment and accomplishments of the country in tobacco control relative to global best practices spelled out in the WHO Framework Convention on Tobacco Control, the global treaty that underpins tobacco control for most countries. We start by listing which of the 9 places in the country are protected by smoke-free laws and a further measure for whether funds have been dedicated for smoke-free policy enforcement. Below that, we tell whether a country is offering the best practices in medication and phone-based cessation support for smokers. Afterwards, we detail the product packaging on the country's cigarette packaging. As you can see here, Thailand has a graphic warning label covering almost 85%, covering 85% of the package, but does not yet have the world's gold standard of plain packaging. Plain packaging means that no logos, colors, or other distinguishing brand characteristics are allowed in the pack beyond the brand's name. The country has gone very far down this road, but has just a little bit further to go. Below that, we detail whether the country has warned its public about the harms of tobacco use in a mass media campaign in the last few years. Further, we utilize data to characterize the important aspects of that mass media campaign to evaluate whether it met global best practices. Just below that, we detail the extent of advertising bans on the tobacco products in the country, split out into direct bans on traditional advertising streams such as TV and newspapers, and indirect bans on the more under-the-radar types of promotions, such as tobacco companies sponsoring charity programs. We track whether countries have direct advertising bans in 7 areas and indirect advertising bans in 10. Those places where advertising is totally banned in the country are listed in the green box below. Finally, you reach the end of the fact sheet where we detail the percent of the cigarette's price in the country that is made up of excise tax. We see here that Thailand's excise tax share is nearly at the WHO minimum benchmark standard of 70%. As I mentioned a minute ago, this information-dense fact sheet will be periodically updated and is always downloadable for our readers. So we're now moving the Tobacco Atlas forward. We're beginning to explore the idea that the internet connects our US-based team to allies across the world. Our goal is to leverage the leading reference on tobacco control to do just a bit of just-in-time research projects. In 2019, we will be launching an effort to collect novel tobacco control data to enhance the project to better understand how tobacco markets function and how policy responses to the scourge of tobacco use actually work out in the real world. Our goal will be to work with all of you to put our collective efforts together and solve real data deficits that might help better understand the tobacco market and provide a competing scientific narrative to industry-funded, local context-specific research projects. We'll be talking more about that in future releases on the Tobacco Atlas blog and in other communication efforts with all of you. When the time is right, we will also be announcing the beginnings of these projects on our social media platforms. Most important, well, the work will either be global in nature all at once, or we'll partner with local organizations to collect data specific to a particular place and time. The initial projects we are considering pursuing are detailed looks at the local tobacco product price markets and/or surveys of illicitly traded cigarettes in areas where illicit trade statistics have not been scientifically established previously. We are truly looking forward to the opportunity to partner with all of you in the audience and our current research partners around the world on this initiative. So to wrap up, I wanted to thank you for giving us this time for this educational opportunity. Our hope is that the Tobacco Atlas will serve as your first and best reference point to understand all things about tobacco control worldwide. Going forward, it is our goal to add as much functionality, information, and utility to this website as we can muster. If you have any questions or comments, please send it to tobaccoatlas.org. We're interested in your suggestions for future material. And in real time, we are also available at our new Twitter handle, Tobacco Atlas. Encourage you all to follow us, and we will follow you right back. And we're just now starting this adventure into social media. So we are eager to engage with all of you on what is new, what is concerning, and what is important in the world of tobacco control. And as always, we are here to provide context and the factual basis of fighting the tobacco epidemic. So at this time, I want to thank you for taking the time to watch this webinar. At this point, I'm open to take your questions. And so what I think I'm going to do is I'm going to kick to our chat window to learn more about what people have asked and or see if other people have questions. If you have questions, you are certainly welcome to raise your hand by clicking through to that functionality next to your name in the chat window. At this time, I want to ask my American Cancer Society hosts if they have any particular questions that have arisen so far. Oh, and I do apologize to the person who said to go slower. I did not just realize that we saw that just now.
Alex, can I interrupt?
Yes, of course, Jeff.
Hi, this is Jeff Drope. I'm also one of the co-authors of the Atlas. I should mention, especially for those who couldn't keep up with Alex's enthusiasm, it will be recorded, and you will be able to listen to it, and we're going to post it on both the Tobacco Atlas website and the Prevent 20 website. Alex, I don't know if you want to start with some of the excellent questions that we've received in the chat room here.
I do see them now, yes. Yeah. So let's start with the question from Beatrice Champagne. I don't know where you're from, but I would love to answer your question. You asked, I wonder, how did you deal with different evaluations of the situation from governments and civil society? So I think that this is a question about how does the Tobacco Atlas reconcile different sources of data on the tobacco epidemic? So that's a great question. It's something we struggle with all the time. So, but what our policy is to go to find what we have determined to be the most comprehensive and authoritative sources on this information. So under our, let's say, who do we turn to figure out how many people actually use tobacco around the world? Our preferred source is something called the Institute for Health Metrics and Evaluation, or IHME. They run a project called the Global Burden of Disease that is a marvelous undertaking of epidemiology, where they combine, for example, on the tobacco epidemic, data from literally every single survey they can find on tobacco use prevalence, and incorporating some computations, they come together on an authoritative estimate of, say, what is the true difference, or what is the true rate of tobacco use in a country. And if we were, say, looking for policy sources, we first go to the World Health Organization's Global Tobacco Control Report Series and the Framework Convention on Tobacco Control's Policy Implementation Database. Maybe what I could do is write up a blog post that speaks to this particular process. I think it would probably be really useful to everybody to sort of break down that decision making. Jeff, do you think I covered the gist of that question, or do you think there's more to add there?
I might just add a little bit here. I think I know what Beatrice is fishing for here. I think sometimes we have very timely issues that happen, and we try to include those on our blog. And as Beatrice knows, we work with many partners around the world, and we work often with them to address those specific timely issues. So for example, if you look through the blog posts, you'll see posts from our partners, Guillermo Paraje in Chile, and Blanca Llorente in Colombia. We're really trying to make sure that the voices of our colleagues are being heard too. Sometimes we proactively reach out to folks, but if there's something happening in your country, we really actually encourage you to reach out to us. We are very excited to feature timely issues that are happening in real time, and giving them the platform on the Tobacco Atlas site for all of our colleagues and friends and interested parties around the world to know more about the situation. And we'll help you write it, and we'll help you put it into the format that we use, and hopefully include some nice visual representations of what's going on. So we really encourage you to do that. And Beatrice, I'm going to also respond to your question about how we interface with our colleagues who also have web presences, like the new STOP initiative and CTFK. We really try to complement one another, I think, and we're all in close touch and talk about these things. Vital Strategies, who is our co-partner with the American Cancer Society on the Tobacco Atlas, is very intrinsically involved in the STOP campaign, for example. But in that case, they are 5.3, Article 5.3, as an industry interference focused. And so we're never going to go into that specific level of depth for one issue. That's just not, that would just be too much for our site. But we will often point our readers towards more reading on these other sites if it's appropriate. So we really try to be aware of what's going on in those other venues, and really we have a very good relationship with those other data sources out there.
Yeah, and so our job here is to sort of sift through the data and come up with what we think is the best answer to someone's question on what is the real situation like on the ground. That's sort of our intent. So, and that's how we view our role as a reference, coming up as the authoritative conclusion on something. So, speaking of something that is very current and it is hard to come up with authoritative answers on, Fiz Anand has asked, he thinks the website is very interesting and useful. Do we have a section on e-cigarettes and heat-not-burn products? The answer is yes, we do. To find it, the best thing you could do if you don't see your particular keyword listed in either the issues or solutions section is to search for it and look through what comes up in the search bar. So it turns out the answer to this is regulating novel products is actually the section that we have used in the website to focus on heat-not-burn and e-cigarettes. And we look at a perspective of how are countries currently responding to the introduction of novel products by integrating current or tobacco control policies, or introducing different tobacco control policies to address novel products. We are certainly planning on expanding our content in this area, but the section, the area changes so rapidly that we're inevitably going to be behind the ball on the latest research in every portion of this content. So, and I think let's keep looking into questions. Beatrice also asked a question I think Jeff asked about how do we relate to other projects like STOP or those by CTFK. Jeff, do you think your prior answer sort of addressed that issue?
I hope so. Alex, I may also mention that, one of the, just to go back to your last answer, one of our main areas of focus and expansion of the site in the coming year will be on novel tobacco products. We're well aware that there could be much more that we could include on the website about these products, and that there's a great demand for it from our users. So we've heard you, and we're going to actually shift resources to making sure that that part of the site is buttressed in the coming months.
Yes. All right. So another question is, did we mention from Yannick Romero was, did we mention a section on tobacco taxation? I did not explicitly mention tobacco taxation, that we have a particular section on it, but in our solutions section, it is section 3. It is a particular specialty of our group. We love talking about tobacco tax, and we have a decently well, we would think, research site about it. You can read more at the taxes section. You can search for tobacco tax in our search bar. We have plenty of posts up about it. And we would totally hope that you would look and learn all you can about tobacco taxes from all these different perspectives. And yeah. And it also a question about e-cigs. We just said that. Jose Luis Vasquez Martinez asked if the individual sections of the atlas were downloadable as a PDF. So we do not have individual chapters as downloadable PDFs. We have individual pieces of the atlas downloadable as pictures, graphs, data. It's not something that we currently do at the moment. What you can do is you can print a particular page at the bottom of every section. You can actually print a page and sort of look at how would it look as a PDF. So if you do this, it's a rather different thing, but you can have a look and see what you think. It's not going to look as slick as the 2-page foldout, but it's also the reason that we don't make the web and the book the exact same is that the web is expandable and we can put so much more content in there than we can in a 2-page fold-out book. However, if you want to see, or a 2-page fold-out book chapter. However, if you do want to see the full version of the Tobacco Atlas and you want to print out 2 pages at a time on a book, you certainly can. At the bottom of the page, of any page, you can click the Download Atlas section, and it will bring you to this PDF version of the Atlas where you can see our lovely authors' faces. And you can have a look at the beauty of this lovely product that we worked so hard to design. And so theoretically, if you are interested in a particular section, let's say tobacco growing, you're in chapter 1, you could print out page 15 or 14 and 15 together, and you would have something approximating a chapter printout. All right, on the next question.
Alex, can I just interrupt for a moment?
Yes.
So we really actually do encourage people to do that. I've been to a number of events, including at the WHO, where they had printed out chapters from the Atlas as a handout, and we strongly encourage people to do that. If for example, you're giving a presentation on tobacco taxes, it's very easy, as you've just pointed out, to just print out those 2 pages you can do it as a fold out, or you can do it as one page with 2 pages on the one loose leaf. So we really like it when people do that. It's a great way to give people a very quick exposure to lots of different ideas in terms of the specific topic area.
And they're beautifully designed. We have these beautiful custom graphics that you can totally use and feature in a really attractive color-paged handout. So I particularly love the marketing section. I think the imagery is really lovely, and you get a really good, quick overview of the area from a global perspective in just 2 pages. So please feel free to use this. We've worked really hard at sharing all that. We have another question from Fiz Anand, which was, is there an email bulletin when new blogs are posted? The answer is currently no, there is not an email bulletin. It's certainly an idea for something we could add in the coming months. What we do currently do is anytime the Tobacco Atlas posts a new blog, it will be tweeted out on the Tobacco Atlas Twitter. We are very new to this, so there's not too many of these blog posts that we've written that are just quite about our own work. But I think we did tweet out the last post that we did. So we have here a Twitter post about the most recent article, which is the summer. Oh, we have a problem with the link. I need to fix that. Sorry. But if we look at, I think, the previous one, which is cigarettes are becoming more affordable in China, you can see we have a little tweet that we put out and a link to our new post. So if you follow us on Twitter, that is a great way to keep up with new content. All right, our next question is there any index to measure the effectiveness of tobacco control policies like the one available for alcohol? I would probably need to familiarize myself with the Alcohol Policy Index. The issue is that we have lots and lots of tobacco control policy areas that are included in the broad umbrella of what we cover in the Atlas. There are some indices of tobacco control policy that we don't actually explicitly mention in the Tobacco Atlas. I think there's one in Europe called the Tobacco Control Scale. We could talk about it at some point and maybe see what a global version looks like. I have toyed with that idea myself. You can look up the tobacco control scale yourself if you were interested to learn more. But the Atlas does not quite do that particular function yet. What we do is put countries in their policy progress into some kind of a regional or at least nominal perspective with the rest of the world. So we can see that the United States has really poor advertising standards if you click on any other country. So what we do recommend is say, take your country, take a peer country. So for the United States, I would probably choose Canada, and you could sort of compare that Canada does a lot better on, say, advertising bans in the United States. The United States has one advertising ban. Canada has 8. So, and actually, this needs to be updated to reflect a policy that was passed just last year in Canada to further tighten up advertising restrictions. So, yeah, that's what I would say sort of on that issue. Is there anybody who has raised their hand wishing to speak or ask another question in the chat window? Or Jeff, do you have any further thoughts?
I don't. Thank you, Alex. I think you've done an excellent job responding to the questions.
Okay, glad to hear. If anybody has any questions, speak now or forever hold your peace. And not really, please, we would really love it if you ask questions to our Tobacco Atlas Twitter handle or our email. We are super eager to interact with everybody. Theoretically, the presence on Twitter will allow us to speak more with all of you and have a better bi-directional relationship. If you ever have questions about the context of tobacco policy or use in your country, we are always eager to help and provide the most current information for the community. And so we're really proud of our product, and we are trying to make it better all the time. We will do our best to keep you in the loop on all new developments of that. So Primarily, we're going to rely on Twitter. For the moment, we will look into developing an email list perhaps later. But we're at the moment just really happy that all of you joined us today. Thank you.
Thank you, Alex. And thank you everyone for joining us. We really appreciate it. And we look forward to interacting with all of you in the coming months.
Well, thank you all, and have a great day or a great night or great morning wherever you are in the world. Thank you.